I don't believe we're going to be able to flatten the curve enough to meet the capacity of the healthcare system.
New York Governor Andrew Cuomo still fears his state's best efforts might not be enough as concern mounts over the demand for respirators, ventilators, and other essential equipment needed for the expected influx of people requiring treatment. Potential exposure to the coronavirus is also limiting the number of nurses available to help treat patients. Connecticut Governor Ned Lamont said last night that 200 employees, including nurses employed by an interstate health system in New York and Connecticut, have been out of work over exposure to the virus. Let's bring in the president and CEO of New York Presbyterian Hospital, Dr. Stephen Corwin. Dr. Corwin, thank you so much for being on with us. I have to start by asking, are your healthcare workers exposed to the coronavirus? Do people who have suspected symptoms of the coronavirus walk in and mix with your healthcare workers in the regular ER?
Well, we've taken extraordinary steps on our emergency department to prevent that, but there's no question that the availability of healthcare workers is going to be key for this crisis, and the ability not to furlough healthcare workers becomes critically important. I think what the president did yesterday was the right move. Having worked with Governor Cuomo now over the past couple of weeks, I think he's made extraordinary steps. I also want to thank all Americans for the sacrifice they're making. We're talking about, as you know, a harsh economic impact, businesses going down, people losing their jobs. But if we can flatten the peak of this, then the hospitals in New York and the surrounding areas can meet the surge.
So there was talk of military hospitals and coronavirus care centers separate from hospitals. I know that's really difficult in New York City. And I believe somebody that we know walked into one of your hospitals and was sitting in a hallway, and he ultimately was diagnosed with coronavirus. Just like what the president is doing, which is separate Americans to protect them, how are healthcare workers in your ERs and in the hallways of your hospitals being separated to be protected? But then again, allowing some healthcare workers who are protected with gear address the problem. Is that worked out yet?
We worked it out in our emergency department, and I saw your segment yesterday with the patient who became COVID positive. Part of the issue is the availability or lack of availability of testing. So we wish him well. I think we followed all the protocols in terms of testing him. We're assuming now when people come into our emergency department that they're going to potentially be infected. And so we've changed the protective equipment for all of our emergency personnel. Remember, Mika, that one of the issues that we have to solve is the availability of PPE, patient protective equipment, in particular masks, which are in short supply.
Dr. Corwin, it's Willie Geist. Thanks so much for all the work that you all are doing. And please send your best to your nurses and your doctors working around the clock on this. As we talk about hospitals being swamped, can you explain what that means exactly, what that looks like, and why that would happen, and implications also for people who don't have coronavirus, other emergencies, other surgeries that may need to be put on the back burner?
It's a great question. First, we canceled all our elective surgeries. All of the New York hospitals, Nassau and Suffolk hospitals, are meeting today to give the governor a report on surge capacity. Second, swamped means, do you have enough ICU beds? Do you have enough healthcare workers? Do you have enough ventilators, et cetera? So we're a 4,000 bed system, 3,500 medical surgical beds. About 10 to 15% of those beds are ICU beds, maybe a little bit more. We have 500 ventilators. We have an additional capacity for 250 ventilators. That's what we're talking about in terms of if we reach those limits, are we overwhelmed? So it's fine to talk about having military hospitals or field hospitals, but it's really people who know how to take care of intensively ill patients, as you saw in Italy. And I think what we're trying to do is make sure that we can flatten that curve so that we have the ICU capability available.
So, Dr. Corwin, you have an audience right now, a lot of people in Washington who can do things about this problem. You have senators and governors and the White House watching. What do you need, speaking not just for your hospital, but perhaps for hospitals across the country, what do you need as of today to flatten that curve and stop yourself from being swamped?
Well, the first thing is everything the president did yesterday and more so that we can socially isolate people, because there's no treatment for this at this point, no vaccine. The second then is make sure we ramp up the manufacturing of protective equipment and ventilators. And then the third thing, to Mika's point, is to make sure that we protect our healthcare workers, which gets back to having enough protective equipment so they don't become infected.
All right, well, keep us posted on that. Dr. Stephen Corwin, thank you very much for coming on Morning Joe this morning.
Thanks for checking out MSNBC on YouTube, and make sure you subscribe to stay up to date on the day's biggest stories. And you can click on any of the videos around us to watch more from Morning Joe and MSNBC. Thanks so much for watching.